The number of coronavirus cases in the Philippines has exceeded 3 million and the surge in Omicron may be slowing down. Manila, the Philippines has hit another grim milestone, tallying over 3 million COVID-19 infections so far as the highly transmissible Omicron variant of the coronavirus tears through the capital and surrounding cities as well as provinces. The Health Ministry reported 28,007 new cases on Tuesday, bringing the country's total to 3.03 million. That marked a retreat from 3 days of record new cases. On Monday, the caseload reached an all-time high of 33,169. Health officials, though, are wary of signaling that the surge may be slowing and nearing its peak. The Philippines is the second worst hit by COVID-19 in Southeast Asia, after Indonesia, but it has been tallying the most number of daily infections at about 30,000 since the start of the year. Vietnam has recorded some 15,000 a day, while Thailand, which is also experiencing a surge, has some 8,000 daily infections. Indonesia has seen Omicron cases tripling in a week, with the health ministry saying the number hit 414 on Saturday. Philippine Health Secretary Francisco Duque has warned that the country remained at critical risk, with the 7-day average caseload rising by 690% and a 2-week growth rate of up to 3,663%. But there may be signs of the surge stalling. Health Undersecretary Maria Rosario Vergeire said the coronavirus seemed to be spreading at a much slower rate, with cases now doubling in 3 to 4 days from 2.2 previously. There is hope that the positivity rate is now stalling or it is close to the peak. If this starts to peak, we may see a downward trend by next week, said Dr. Guido David, a senior research fellow with the independent Octa Research group. But he believed it was too soon to say if the surge had indeed reached a peak, noting that while infections seemed to be slowing down in Metro Manila, cases were still climbing elsewhere. The health ministry reported that hospitals were seeing far less COVID-19 patients than during the surge fueled by the more deadly Delta variant in September and October last year. It said most of those being admitted at hospitals were, in fact, incidental patients who showed up at emergency rooms with other ailments such as appendicitis or a stroke, or had been in a traffic accident, but were later found to have the coronavirus. More than half of hospital beds in Metro Manila are currently occupied, which the government sees as still acceptable, considering the explosion in cases in recent weeks. Dr. John Wong, an epidemiologist and advisor to the health ministry, said hospital use was 60% lower compared than when the country was in the grip of the Delta outbreak. The difference was that more people were vaccinated now. Vaccination is protecting Metro Manila from high hospitalisation rates, he said. Mr. Carlo Nograles, the spokesman for President Rodrigo Duterte, told reporters the government was ready to elevate its response with more mobility restrictions should hospitals report 70% occupancy. But that seemed unnecessary right now, he said. We still haven't reached the threshold, said Mr. Nograles.